Hi, students. I am going to go through Chapter 11, PowerPoint 2021, and I'm going to talk about the CMS 1500 and the UB04 claims form. Okay, so this will be our chapter outline and different objectives. So let's dig right into what we're going to be doing. So the CMS 1500 claims form. This is for professional services. So this is going to be how your doctor, possibly physician assistant, nurse practitioner, how they're going to get paid. Okay, this form here gets sent to the insurance company after it is filled out. Where the UB04 claim is from, going to be an institutional service. So this is how your hospital facility would get paid. So this is what the CMS 1500 claim would look like. Keep in mind, there's a better copy of this in your textbook. But as you can see here, it asks what insurance up here. You have to fill out the patient's name, the type of insurance they have, dates of service, and then we will get into the actual coding aspect next week. Codes have to go down here. And keep in mind, those codes have a numerical number, and that numerical number draws a payment. So based on what CPT code gets put onto this claim determines how much the patient's going to get charged that the physician can bill for. Again, this is physician. This is coming out of the physician office to the insurance company. Now this one here is kind of the same format, but this is what a hospital would send to the insurance company. Once again, they're going to put the patient's name, the insurance company, the services, CPT, ICD-10, PCS codes, which you do not use for this course, nor will you see them unless you are working as an inpatient in a hospital setting. Okay, so let's go back to the CMS 1500 data entry. It is optical scanning guidelines. We have also, you put the patient policy names, which I talked about, providers, mailing address, recovery funds from responsible payers, the national provider identifier, which is going to be a number, the assignment of benefits versus accept assignment. I've talked about accept assignment, par, non-par, reporting of diagnosis, ICD-10 codes, and then, like I said, we're going to get into CPT codes, HCPCS codes, all of this within the next couple of weeks coming up. And then you have the National Standard Employer Identifier. So a couple of big things. This is the provider. So if we're talking about the CMS 1500, this provider would be, let's say, Dr. Smith. They're going to have their own provider number. Employer identifier, let's just say we're talking about medical associates. They will have their own identifier number. Assignment of benefits versus accept assignment, right? So assignment of benefits, this patient signs the CMS Block 1300 or 13 to instruct the payer to directly reimburse the provider. Okay, so one thing to keep in mind is that the patient doesn't take this form and sign it. As a patient, when you go into the physician office, sometimes it used to be you would sign a sheet saying, yes, you accept a benefit. But now with all the new HIPAA laws, for you to go to the physician, it is basically stating that you accept the benefits, okay? That you, with going to that doctor, you're okaying for them to directly reimburse that provider. And then here, you're going to check, yes, accept assignment. Okay, so reporting codes on the CMS 1500 and UB04 claims. As you can see here, we haven't talked about or completed ICD-10 codes, but it's always a alpha, and then we have our numerical numbers, okay? So these are diagnosis, which we will learn about, ICD-10. And then date of service, place of service, and then you're going to have the procedure code. This comes out of the CPT book. And then the diagnose pointer. So they're saying for this procedure or this evaluation that the patient came in for to see the doctor, that A and B, this diagnosis and this diagnosis were utilized. And this is, I think, bronchitis, and this is a symptom code. All right. So processing in the secondary CMS 1500 claims. These are filed after the remittance advice from the primary payer is paid or received. You attach the remittance advice to the secondary claim. When the primary and secondary information is entered on the same CMS 1500 claim, then these boxes are going to be filled out. Okay, so a couple of different things. Remittance advice. What is that? So for those of you under your parents' insurance or possibly significant other, whatever insurance, you get the remittance advice back from the insurance company. What that is, that's telling you what they're paying. Okay, so let's say you have two insurance companies, and that's what we're talking about here. Secondary, so they take what that first insurance company paid, they send that remittance advice to the secondary insurance. A good example is I'm double covered under dental. So it always goes through my dental insurance first, and then they take what that insurance paid, which would, let's say, Delta Dental, then they send it to my husband's dental insurance. So they know they don't overpay. They know what that first insurance paid, so they know what they are left to pay. Okay, so these are different blocks in this form. Okay, primary insurance payer is marked, so Medicare, Medicaid, TRICARE, what is the insurance? Then you put the insurance number down, primary insurance number. Second, if there is a secondary insurance. Not everybody has secondary insurance. Really, you don't see that too often. Double covered. You're going to see it more with Medicare, and then they have a supplemental plan. And then here would be your primary insurance. For me, would be Blue Cross Blue Shield. But let's say somebody had Medicare, and then here it would be, let's say, HMO. Common errors that delay the CMS 1500 claims processing, keyboarding errors, incorrect entry of data. So again, people start typing out codes real fast. Omission of data, that means you don't have enough. Attachments that do not contain patient ID. Failure to properly align the claim in the printer. Handwritten items and messages other than signatures, and failure to link procedure with correct diagnosis. So then we have the final steps. Step 1, you want to double check that claim for errors, add in any necessary attachments, post that submission of claim to the patient account, and then save the claim in practice management software, and then submit the claim to a payer or clearinghouse. And what a clearinghouse is, I'm going to give you a real quick example. So I'm going to use Medical Associates again. So let's say that the CMS 1500 form, the insurance person gets done with everything on it, and then they hit submit. Okay. At Medical Associates, they have a clearinghouse. So like once a week, they take all the insurance claims that came to this clearinghouse, they release them all at once. What I mean, with all these claims for that whole week, some will go to Blue Cross Blue Shield, Medicare, Medicaid, HMO, whatever the insurance company is, they all go out at one time. A lot of times these clearinghouses will scrub, so they'll look for any errors. Okay, maintaining for medical practice. So this here, you have insurance file set up. It's opened up by cases per month and the payer. Closed cases by year and payer. You have, they come into batches. I talked about the RAs already. And then file unassigned or non-participating claims by year and payer. Processing assigned paid claims. So again, this would be the remittance advice reconciliation. UB04, okay, now we're talking hospital claims. This bills the hospital. But these blocks are called form locators for input of information, automatically generated from the charge master, entered by the providers. So this is kind of what the UB04 data screen looks like. All right, so the National Uniform Billing Committee, they have the same thing as the Uniform Claims Committee. They identify and revise data elements. So they're the ones who keep that UB04 consistent, any new updates. They are virtually the one who controls what's on that form. Data specifications for the UB04, they have balanced payers to collect information against burden of providers. HIPAA has provisions are applied when developing the data elements that go on it. And then each data element is assigned to a unique UBO form locator. Okay, claim submission. This would be the same thing kind of with the CMS 1500. You have your form locators. The data is entered according to third-party payer guidelines. And when we're talking about that, Medicare is going to have different guidelines than HMO, Blue Cross Blue Shield, Medicaid, TRICARE. Okay, so whatever third-party payer guidelines are, they're going to be different across the board. Back in the day that I worked at Medical Associates, I was a coder. Plus, I did, I worked closely with the different insurance. So if a certain, like if the Blue Cross Blue Blue Shield person had an issue with a claim, they would come over and ask me, "Is this code correct?" The person that did strictly Medicare, strictly Medicaid, once again, they knew exactly what belonged on that form, and they specialized in that. So you do have adjustment claims. So if something was wrong, you had the adjustment claim, which you could change things. So form locators for type of bill and then 18 through 28 condition codes, they are completed on each form. So you can go ahead and look at your UB04 claim again. So correcting, supplementing UB04 claims for if it reopened, so if there was something wrong with it. So reopen claim, okay? You have timely filing limit, sometime reopen with 1 year of date of receipt. Reopen 1 to 4 years date of receipt, that's really a long time. And sometimes you have the appeal process where they're saying, hey, this isn't right. We're going to appeal this form and we want to resubmit the information. So hopefully this helps with Chapter 11. If anybody has any questions or concerns, please let me know.